Kymera is a CAR T-cell therapy approved by the FDA in 2022. This treatment aims to cure patients who have acute lymphoblastic leukemia, diffuse large B-cell lymphoma, or follicular lymphoma. Kymera is prescribed for patients who have relapsed, so when the cancer has come back, or are refractory when the cancer stopped responding to treatment, after at least 2 different kinds of treatment, usually chemotherapies. This therapy is not specific to cancerous cells, since every mature, immature, memory, and activated B cells express the antigen. The CAR T cells will recognize both healthy and cancerous cells. Concerning the efficacy, over 63 patients with B-cell ALL, 83% achieved complete remission, and no relapse was observed until the end of the study. This study underscored the promising efficacy of the drug. Despite its public price of $475,000 US, it is reviewed as cost-effective for patients who have failed at least 2 lines of prior therapies, as it offers long-term results. The first step in manufacturing these CAR T cells is indeed the isolation of peripheral blood mononuclear cells from the patient's blood through a process called leukapheresis. The leukapheresis will separate the PMBC from the blood, which will return back to the donor. This step ensures the isolation of the necessary cells for CAR T cell production. The cells are then cryopreserved and are sent to the manufacturing site, where they will be washed, activated by antibodies-coated beads to promote proliferation of T cells. After this, the cells are transduced with a lentiviral vector encoding a chimeric antigen receptor, the CAR, to identify and eliminate CD19 expressing B cells. Malignant and normal B cells, so immature, mature, activated, and memory B cells, will be targeted. The transduced CAR T cells are then expanded in culture using a wave bioreactor, allowing the controlled growth and differentiation of the transduced CAR T cells. The bioreactor is designed to mimic the in vivo environment, providing optimal conditions for the CAR T cell to proliferate and differentiate. It takes several days to weeks before having the right concentration of CAR T cells. It will then undergo a selectivity test to assess viability and several quality control measures. Lastly, the CAR T cells are then cryopreserved to be distributed and prepared to be used for therapy. Before the infusion of Kymera, patients undergo lymphodepleting chemotherapy to facilitate CAR T cells expansion and persistence in the patient. The Kymera infusion is then administered intravenously. The CAR T cells will recognize the target antigen, CD19, expressed at the surface of cancerous and healthy B cells, and it will induce the death of the cell. And that's it for the manufacturing and treatment cycle of Kymera.
Problems with Kymera is a complex process of manufacturing, into toxicities and low efficacy.
For the first purpose of incubation is delivery of drug. The first is intratumoral. This method offers a deliver a concentrated dose of CAR T cells to the tumor, enhancing the ability to attack cancer cells and reducing the risk of damaging healthy tissue. By focusing the CAR T cells in the tumor area, it improves safety and can increase the effectiveness, leading to better tumor control and regression. Next is intraperitoneal. It offers an administrating substance directly into the peritoneal cavity, where organs like stomach, liver, and intestines are located. By administering it, the CAR T cells can lead to rapid expansion and persistence in the blood, enhancing the anti-tumor activity by directly interacting with and eliminating tumor cells in the peritoneal cavity. For the formulation, the first is suicide gene. Suicide gene allows the selective destruction of infused CAR T cells to prevent harm to healthy cells and tissue. By consuming a drug that can activate the suicide gene, it can lead to rapid cell death. This is important in addition to CAR T cell therapy because CAR T cell can cause severe side effects excited post-release syndrome, neurotoxicity, and off-target effect. Next is nanomedicine. It simplifies CAR T cell production by using a biodegradable polymer matrix with antibodies gene. This eliminates the need for bit removal, making the process faster and resulting in better quality cells. The matrix acts as a scaffold, allowing the T cells to grow and be modified without the need to bits separation. For manufacturing, the first is transposon. Transposon are a non-viral method that can be used to insert the CAR gene into the T cell efficiently and specifically, be able to reduce off-target effects in CAR T-cell manufacturing. Positive peripheral blood molecular cells are used because they have a memory-rich phenotype and fewer exhaustion markers, enhancing the long-term persistence and effectiveness of CAR T-cell. The next is electroporation. Electroporation is also a non-viral method that can be used to insert the CAR gene into the T-cell. It works by applying an electrical pulse to create a temporary pulse into the cell membrane, allowing the CAR gene to enter the cell by creating small temporary pulses in T cells.
Identification on proposed innovation. Firstly, optimal dose and regimen for intratumoral immunotherapy have not yet been determined. The right dose depends on the patient's weight. It is expected to change based on the immunostimulating agent safety profile and the agent's combination. Whether a treatment regimen is more likely to result in systemic toxicity or local reaction can also influence which dosing algorithm is the best, and the combination agent use can affect the overall treatment. Next, first pass metabolism for IP or intraperitoneal. The chemical absorbed from the peritoneal cavity end up in the portal vein and travel by the liver, which resulting in a decreased systemic exposure of compounds administered via IP. The IP is costly, and the sterility of injection of IP should be considered, where the injection can cause irritation where it could lead to ileus and peritoneal inflammation. ICAS binary system on CAR T cell. The anti-transgene immune responses act against the resistance or society genes. The transferred T cell did not persist in patients in a study of anti-CD19 CAR T cell, where it co-expressing a modified hygromycin resistance or HSV decay site gene fusion, which it highlights the necessity of close clinical monitoring of vector persistence and anti-transgene immunity in clinical trials of T cell expressing ICASP9. Immunosuppression and immunostimulation of nanomatrix technology. The immunosuppressive substance, including radiation, cadmium, tetrachlorodibenzoyl P-dioxin, work against T cells by compromising their growth and ability to function. The tumor-associated immune cells are stimulated and encouraged to transform into tumor supportive phenotype when the complement system is activated at the location of tumor, which accelerates the growth of cancer. Next, the time for manufacturing the SB-engineered CAR T cell or sleeping beauty engineered CAR T cell. The time required is 4 weeks to manufacture, and 95% of CAR T products that can be evaluated are made using viral vector, with lentiviral vectors mediating over 50% of the preparation. The lentiviral vectors are randomly integrated into the cellular genome during the CAR gene integration process in T cells. It causes negative impact on the host genome and increases the risk of unintentional gene silencing, overexpression, or genetic mutations. Electric pulse used in electroporation may cause harm. The electric pulse characteristic like waveform shape have direct impact on EP performance. The polarity of electrodes affects membrane permeabilization and delivery. Lowering cellular toxicity is significantly affected by the polarity of the electric field. And the direction of charged molecules, electrophoretic integration is influenced by their polarity.
So now I will talk about the consequences of the development of product and process to the society and the environment. Consequences to society. The first one is improved effectiveness and safety. These developments are designed to increase the effectiveness and safety to the therapy, resulting to better patient result and lower healthcare expense. The second one is enhanced patient outcome. The utilization of suicide gene technology can guarantee the targeted eradication of CAR T cells and hence diminishing the likelihood of unintended impact. The third one is the reduced healthcare costs. By improving the efficiency and safety of the treatment, the requirement for further intervention and extended hospital stay can be greatly diminished. The fourth one is the enhanced public awareness. The general public can gain greater assurance, which can turn to greater backing for additional study and advancement. This increased support may encourage more funding and resource dedicated to this field, further accelerating innovation. And the last one is improve the public confidence. By structured study and engaging in transparent communication, the public can gain increased confidence in the potential benefit to new technologies. Next is the consequences to the environment. So firstly is exposure to high doses can be reduced. High doses that may leak to the environment can be reduced by successfully delivering a high concentration of immunotherapies directly into the tumors. The second one is reduced waste generation. Exact control over material properties is possible, leading to the development of more productive processes that produce less pollution and use fewer resources. The third one is enhanced source efficiency. The utilization of methods such as transposon and electroporation not only improve the effectiveness of the production process but also leads to the substantial decrease in the resources needed to manufacture the CAR T cell. The fourth one is the utilization of harmful chemical. The applications such as nanometric technology can present hazard to the ecosystem and human well-being because of their minuscule size and distinctive characteristic may result in accumulation of this material in living organisms and potential harmful effect. And lastly is higher energy usage. Uh, this innovation may require significant amounts of energy to function successfully. If improperly handled, this increased energy demand could worsen already existing environmental issues by increasing the greenhouse gas emission and accelerating climate change.